there was a study that just came out from the University of San Francisco, University of California, San Francisco, came out with a study and saying, this whole system is totally nuts. Now, this director's brother came in to me, he had a car accident. He spent an hour and a half in the hospital and cost him $18,000. Where on earth can you go into a place and not know how much it's going to cost you, whether or not you want to do it, and just rip you off for an hour and a half? And they did nothing except over-radiate him, pretty much malpractice in any other type of professional type of attitude. And I'd be happy to defend any doctor. Give me a call. 3 or 4 CT scans, 3 or 4 sets of X-rays for an accident. For $18,000. It's kind of crazy. So this new study that just came out from the University of California at San Francisco, just saying, tells about this man, 34 years old, had some abdominal pain. Goes into the ER room, and first of all, the doctor once again says, okay, yeah, you got appendicitis, we're going to do surgery. Too bad this quack hasn't read what we talked about on my TV show and maybe on this thing. It's just 2-3 weeks ago they're saying, yeah, most appendicitis you don't have to have surgery. Even just using, which I don't think is the best way to go, using drugs, 60% of the appendicitis can be treated very easily. So spending hundreds of dollars versus, as he found out, cost him $60,000 to have this appendix. So this doctor, so this guy's friend is a doctor at UCSF. So she started investigating 19,000 patients. And this is what a scam this is, because the sick care system is a monopoly. There is no fair trade. There's no competition there. An appendix surgery can range from $1,800 to $182,000 for exactly the same procedure, uncomplicated appendicitis. That's how crazy things are. Can you imagine going into a store, say you go to your grocery store, and you buy a can of soup? Now, I'm from New Jersey, we'll talk Campbell. I don't think it's a great soup, but it was just Campbell. One place you pay 25 cents, another place you go in there, and this is they bill you after you leave for for $4,000. And you'd be happy with that? No, people would go nuts. They'd be thrown in jail. This is what happens every day. So as we've talked about on this show here, is that he stated, quote, I thought I had good insurance. That's part of the problem. People walk around thinking, I don't care how much it costs because I don't pay. Well, sure, someone pays. If you don't pay, then I pay. You're ripping me off for, once again, finding quacks, finding crap that doesn't work, and thinking that everything's free. So he goes in there, he gets a bill for like $23,000 because his so-called great insurance only paid for 80%. So now he has to pay, and now he's all pissed off. Well, that's what people have to start doing, is once again, pay attention. So anyway, so the person that's on my TV show is calling the hospital and saying, how is this possible for an hour and a half costing $18,000 and he can't get any answers? Can you imagine, you go to your car mechanic, or say you go get someone a carpet cleaner. They come in, clean your carpet, everything's good. And you're thinking, maybe a couple $100, and then you get a bill for $45,000. And then you call and say, that can't be right. Oh, well, I don't know. I only work here, and I'm only in terms of, accounts receivables. You need to talk to this person, but they get paid $400,000 a year, but they're never around because, they're going to special drug type of seminars. I mean, he's just getting this runaround. It's totally nuts. So, but that's what people, I guess, like. Same with Medicare and Medi-Cal. It's crazy. I mean, another report just came out, Social Security, once again, doesn't have any money, but, people walk around thinking, oh, I'm going to be taken care of. Good luck.